Hello everyone. So today we just talk about the nitric oxide anti-hypertensive role. So how does nitric oxide will do the anti-hypertensive action and what is the mechanism behind that? So nitric oxide was declared as a molecule of the year by the science in 1992. So as we all know, the sodium nitroprusside is widely used for the severe hypertension, and it can also improve the cardiac function in the patients with the left ventricular failure. So it's widely used in the medical field. So this nitroprusside drug will act by releasing the nitric oxide, about which we are going to talk. How does it work and how it will create the antihypertensive action. So before we talk about nitric oxide mechanism of action as antihypertensive role, we just go through the different isoforms of nitric oxide synthase. So this NOS is the enzyme which is used for the synthesis of nitric oxide. So there are three major isoforms of nitric oxide synthase, and its molecular size is ranging from 130 to 160 kilodalton. Apart from that, the amino acid sequence of nitric oxide synthase between any two isoform is about 50 to 60%. So they are matching by 50 to 60% of their total structure. And isoforms of nitric oxide synthase exhibit differences only in tissue localization, the transcriptional regulation, and activation by the intracellular calcium. So these three isoforms are, one is the neuronal nitric oxide synthase, which is located in the nervous tissues and skeletal muscle type 2, and the main role of that neuronal NOS, that is cell communication, so it is considered as NOS1, or otherwise it is known as the NNOS. The second NOS2, that is known as the INOS, which is a indivisible nitric oxide synthase. So this indivisible NOS is present in the immune system and the cardiovascular system, and it plays the major role for the removal of the pathogens and thereby in the immunity of the body. And the most important, that is the endothelial NOS, that is known as ENOS or NOS3, which is present in the endothelium of the vessels, and it has major role for the vasodilation of the vessels. So NO is one of the most regulated enzyme in the biology. So out of these three isoforms of NOS, the two are considered as constitutive enzyme, that is ENOS, that is endothelial NOS, and NNOS, that is neuronal NOS, which are regulated by calcium and colmodulin. Whereas the third type, that is the indivisible enzyme, which is present in the immune system, it is known as the INOS, and which is calcium independent. So please be remember, there are total three isoforms of nitric oxide. Out of these, two are considered as constitutive enzymes, that is CNOS, which are regulated or dependent on calcium and calmodulin, whereas the third type, that is NOS2 or INOS, which is calcium independent and it cannot affected by the calcium level. So now we just see the function of ENOS, that is present in the endothelium of the vessels, and that is a calcium dependent, as we talked earlier. So with the release of various neurotransmitter, with the help of calcium, these NOS will be activated, and these endothelial NOS, that is present in the endothelium of the vessels, will leads to conversion of arginine into nitric oxide, and this nitric oxide will act on guanyl cyclase, and thereby it will form the more amount of guanyl monophosphate, that is CGMP, and this CGMP is a phosphodiesterase inhibitor, and thereby it causes the relaxation of smooth muscles like vessels and all. So this is how the ENOS will produce the NO in the endothelium of the vessels, and thereby it leads to activation of guanyl cyclase and ultimately leads to the relaxation of the vessel. So by this mechanism, the sodium nitroprusside, which contains the NO, causes the vasodilatation, and thereby it causes the antihypertensive action. So thank you so much. That was about the role of nitric oxide as antihypertensive action, and most widely it is used in the medical field as a drug of sodium nitroprusside. So when you talk about sodium nitroprusside, your mind should strike the NO and the mechanism of action of nitric